Okay. So coming to development of dentition and occlusion. Okay.
Yeah.
So here we have in development of dentition, that is the tooth, we have 4 stages.
Yeah.
Bud stage, cap stage, bell stage, and root formation. So in between this bell stage and root formation, there's something called as advanced bell stage. It is not a stage of tooth development, but that is a phase. Okay. So dental lamina, from here you derive mesenchyme and ectoderm. Correct? Dental lamina is one plain layer from which the upper develops to form an ectoderm and the lower part differentiates to form mesenchyme. So this together is called ectomesenchyme. Ectomesenchyme.
Okay, actually the voice was breaking just now. Can you just repeat it? Hello?
Okay. Yes. Okay. So this is the dental lamina. Okay. Initially during development, you will have a layer called dental lamina from which the bud or the tooth starts to develop. Okay. So this dental lamina is further differentiated to form the outer layer, which is the ectoderm, and the inner layer, which is the mesenchyme. Okay. So now this together is called ectomesenchyme. Ectoderm, ecto you take, and mesenchyme. So together you call it ectomesenchyme. Clear? Okay. So after this ectomesenchyme is formed, you start developing a placard. Placard is nothing but a small projection from which the tooth development initiates. So it's a small projection. Like this only undergoes this projection, which is called a dental placard. Fine? So this further undergoes differentiation to form a bud stage. It's the shape of a bud. Okay. So then this bud further differentiates to form a cap stage. See here you can see the tooth development started. So this cap stage further differentiates to form a bell stage where the exact crown structure is developed. Correct? So now after this there's something called as late bell stage or advanced bell stage where this ectomesenchyme differentiates and the tooth itself completely is formed with enamel, dentine and pulp. Okay. After that you have something called as root formation, which is later after the crown formation is completed. So these are the, yes, tell me.
Hello?
Yes, tell me.
Yeah. Should I say that? Hello?
No. If you understand, it is well and good. If you understand, it's fine. Any doubts, you can ask me in between. Okay. So when coming to stages of tooth development, we have bud stage, cap stage, bell stage, and root formation. Okay. So there will be a 10-marker question which is asked stages of tooth development. So in that stages, you'll have to only write about bud stage, cap stage, bell stage. No root formation. No writing root formation. Okay. So in detail, I'll be telling you in the next slides. Okay. This is just overview. Like what are the stages? Coming to development of occlusion. So in development of occlusion, we have something called as predental period, deciduous dentition, mixed dentition, permanent dentition. Clear? Pre-dental period, there are only gum buds. After that, we have deciduous dentition, which is milk tooth. Mixed dentition, where there is few of milk tooth, few of permanent tooth. And permanent dentition, where all the milk teeth are replaced by permanent teeth. Okay. So stages of tooth development is bud stage, cap stage, bell stage. Periods of occlusion development is pre-dental period, deciduous dentition, mixed dentition, permanent dentition. Clear? See, this is just the overview. Like under that heading, what and all you should write. So in detail, we'll be going in the next slides. So till here, is it are you able to understand?
Yeah. Actually, I know a little bit of
the pace what I'm teaching.
Yeah. Hello.
Okay. No, the pace where what I'm teaching, is it too fast or too slow, or is it okay?
Actually, I know a little bit of it, so I can like grasp it a bit easily. So, hello.
Okay. Yes. Tell me.
Yeah, I know a little bit of this topic, so I can grasp it a bit easily.
Okay.
Yeah.
Okay.
Yeah.
So coming to the next one. So tooth development, the embryonic oral cavity is lined by stratified squamous epithelium, which is called oral ectoderm. Correct? That is what the ectoderm we spoke earlier in the dental lamina.
Yeah.
Okay. So around 6th week of intrauterine life, maxilla and mandible borders show localized proliferation of oral ectoderm, resulting in the formation of horseshoe-shaped band of tissues called the dental lamina. So here what they're trying to tell is in the 6th week when the baby is developing in the mother's womb, the maxilla and the mandible starts developing. That is when the dental lamina forms a horseshoe shape. Horseshoe is nothing but U-shaped. That is how our arch is like. The maxilla is also U-shaped, the mandible is also U-shaped. Okay. So that will happen in the 6th week of intrauterine. Okay. So after that, the deciduous teeth are formed by direct proliferation of dental lamina. Because deciduous teeth are the first teeth to erupt. Permanent teeth are the successors of deciduous teeth. Correct?
Yeah.
Okay. The permanent molars develop as a result of distal proliferation, while the permanent teeth that replaces deciduous teeth develop from the lingual extensions of dental lamina. So here what they're trying to tell is, see, already deciduous teeth will be in the arch, always lingual, that is towards the tongue, always lingual to the deciduous teeth, the permanent teeth erupt. Correct?
Okay. Yeah.
But since from first molars, there is no deciduous teeth. First molars comes directly. Correct?
Yeah.
See, incisors are replaced by permanent incisors. Canines by permanent canines. Deciduous molars are replaced by permanent premolars. Clear?
Yeah.
So permanent molars do not have any predecessors. They are the first tooth permanent which erupt. So they erupt from the distal part of the deciduous tooth.
Okay. Yeah.
Distal is the last, like towards. Okay. So the permanent teeth which replaces the deciduous tooth erupt from the lingual side, whereas the permanent teeth distal to the deciduous tooth erupt directly. Okay, that is what they're trying to tell in the last point. Clear?
Okay.
The ectoderm in certain areas of the dental lamina proliferates to form knob-like structures that grow into underlying mesenchyme. Each of these knobs represent a future deciduous tooth and is called enamel organ. Excuse me. Sorry. Yeah. So what they're trying to tell is, after the ectoderm mesenchyme is formed, I told you they undergo proliferation to form a knob-like structures, which each one represents one tooth. Development of one tooth. So that representation of the knob is called enamel organ. Okay. Always remember, tooth eruption takes place from enamel organ. Okay. The enamel organ passes through number of stages, which is the cap stage, the bud stage, the cap stage, and the bell stage, to ultimately form a tooth. Okay? Clear?
Yeah.
Based on the shape of the enamel organ, the development of the teeth can be divided into bud stage, cap stage, bell stage. Okay? So coming to bud stage, what happens in bud stage? Initial stage of tooth formation. Enamel organ represents a small bud. It is lined by peripheral columnar cells and central polygonal cells. See, number 3 represents peripheral columnar cells, peripheral low columnar cells. Number 2 represents central polygonal cells. Okay? Number 1 represents a complete enamel organ. This is the enamel organ. Clear? Below enamel organ, see this part below enamel organ is called dental papilla. The area around all this is called dental follicle. Dental papilla, DP. It leads to formation of dentine and pulp. Remember like this, dental papilla, dentine and pulp. Okay? Dental follicle or dental sac, the other parts, that is the cementum, PDL. Okay. Enamel is formed directly from the enamel organ. So dentine pulp is formed by dental dental pulp, your dental papilla, and cementum PDL is formed by dental follicle or dental sac. Clear?
Okay.
You should remember so many points when you're writing about bud stage and draw the diagram same way in H&E pencil.
Okay.
H&E pencil, same way you have to draw the diagrams. Okay?
Okay.
And you should remember so many points about bud stage.
Okay.
What is it? It's the first stage of tooth development. At enamel organs represent small bud, peripheral low columnar cells, central polygonal cells. And below enamel organ is dental papilla.
Dental
papilla. Surrounding the enamel organ is dental sac. Dental papilla forms a dentine and pulp. Dental sac or dental follicle forms cementum and PDL. Clear?
Okay.
About bud stage?
Okay.
Okay. So coming to cap stage. See, now here the bud is underwent proliferation to form a cap. Clear?
Okay.
See, it is slowly taking the shape of the tooth.
Yeah.
Okay. Tooth bud continues to proliferate, resulting in cap shape.
Okay.
Outer enamel. So there you had only peripheral and central. Okay.
Yeah. Yes.
So here what happens, due to invagination, we have something called as outer enamel epithelium, inner enamel epithelium.
Okay.
See here, arrow mark. Inner enamel epithelium is inside the enamel organ. Outer enamel epithelium is outside the enamel organ.
Yeah.
Clear?
Yeah.
So here outer enamel epithelium is lined by cuboidal cells.
Okay.
Inner enamel epithelium is lined by tall columnar cells.
Okay.
And in between, what polygonal cells we had in bud stage underwent changes to form stellate reticulum.
Okay.
Stellate reticulum. Again, you have dental papilla, dental follicle or dental sac.
Okay.
Are more pronounced in this stage. They are like more evident comparatively to bud stage. Okay.
Okay. Okay.
So in bud stage, you should write the enamel organ undergoes proliferation to form a cap stage. Then again, you should write it the enamel, the lining is differentiated into outer enamel epithelium, inner enamel epithelium. The outer enamel epithelium is lined by cuboidal cells. Inner enamel epithelium is lined by tall columnar cells. The central area is differentiated to form stellate reticulum. Dental papilla, dental sac are more pronounced in cap stage. Clear?
Yeah.
Clear with cap stage? Clear with bud stage?
Yeah.
Okay. So coming to bell stage. So here in bell stage, what happens is, see, you have this connection from the dental lamina to the tooth bud.
Yeah.
But in bell stage, that connection is lost. So the tooth is almost formed. Okay.
Yeah.
Enamel organ takes the shape of a bell. So this is the bell shape. Inner enamel epithelium tall columnar cells differentiates to form ameloblast, which further forms enamel. Clear?
Yeah.
Inner enamel epithelium tall columnar cells differentiates to form ameloblast, which further forms enamel. See, okay, ameloblast form enamel. Odontoblast form dentine. Okay, remember this. Cementoblast forms cementum.
Okay.
Okay. So the squamous cells between the inner enamel epithelium and the stellate reticulum called stratum intermedium is essential for enamel formation. So here what you're trying to tell is, see, this is the inner enamel epithelium lined by tall columnar cells.
Okay.
There is one more layer above that inner enamel epithelium which is lining, which is called as squamous cell layer. So see, this was the outer enamel epithelium, inner enamel epithelium, stellate reticulum. In between stellate reticulum and inner enamel epithelium, you have this squamous cell layer.
Okay.
That is called a stratum intermedium because it's an intermediate layer between stellate reticulum and inner. Okay. So it's called stellate. This is called stratum intermedium.
Okay.
So what does this stratum intermedium do? It takes all the nutrients from stellate reticulum and gives it to the ameloblast for helping it forming enamel around the tooth.
Okay.
That is why they've given it is very essential for enamel formation.
Okay. Okay.
The cells in the dental papilla differentiate to form odontoblast because they have to form dentin, right? DP, dentin and pulp. So the dental papilla cells differentiate to form odontoblast. Which further forms dentin. And the dental sac, the arrangement of fibers forming PDL that span between the root and the bone because they have to form PDL and cementum. So the tall columnar cells differentiates to ameloblast. In dental papilla, the cells differentiates to odontoblast. And you have stratum intermedium between stellate reticulum and inner enamel epithelium. Okay.
Yeah.
So this is about the Bell stage. Are you clear?
Okay. Yeah.
With Bell stage, you want me to repeat it once again, or it's clear?
Yeah, it's clear. It's clear.
Okay. Here you have oral enamel epithelium, which undergoes proliferation to form the, what is this called? Placard. Placard. So that placard further differentiates to form bud stage. Bud stage, invagination, cap stage. Further development of the tooth, Bell stage. Advanced Bell stage, it is lost the contact with the oral epithelium, the placard, the bell, and further the tooth erupts in the oral cavity. Okay, clear with the stages of tooth development?
Yeah.
So initially, then you have bud stage, then you have early cap stage, then you have late cap stage, then you have Bell stage. Okay. Any questions in this? Anything you want me to ask? Anything you want me to repeat again?
No, actually, I have gone through this sometime before, so I know a little bit about this topic. Not very much, but
okay. So next, coming to periods of occlusal development. So an occlusal development can be divided into following: pre-dental period, the deciduous dentition, mixed dentition, permanent dentition. Okay. So in pre-dentate period, what happens? Gum pads are thick, firm, covered by dense periosteum. Bone covering the gum pads, correct? Labiobuccal and lingual. Gum pads are divided majorly. Firstly, the gum pads are divided into labiobuccal and lingual. That is how you can divide because there are no teeth, right? So the inner, the outer. Okay. And there's something called as dental grooves. And there is something called as transverse grooves present, like in the canine prominence. Transverse grooves, which divides the anterior and the posterior region. Okay. And lateral sulci. Lateral sulci is nothing but the individual grooving between labiobuccal and lingual. There is one groove present. So that is called as lateral sulcus. And you know what is ovojit, ovobite, horizontal, vertical. That is fine. Okay. So then you have infantile, open bite. Then neonatal and natal tooth. What is neonatal? What is natal? You know, right? Neonatal is before the birth. Natal tooth is before the birth. Neonatal is within the 1 month span of the birth. Okay. So coming to next is the deciduous dentition period. The eruption of primary tooth happens from 2.5 to 3.5 years. Eruption of sequences A, B, D, C, E. Incisors, canines, first molar, central incisor, lateral incisor, first molar, canine, second molar. A, B, D, C, E pattern. Okay. Development of physiologic spaces. These are the natural spaces which are present between the primary tooth. See, why these spaces are present is, see, primary tooth is small in size. Permanent tooth are bigger in size. To accommodate the permanent bigger tooth, the deciduous tooth are always spaced, which is the physiologic and natural space. Okay. So this is not some deformity. Okay. So then there's something called as primate space. What is this primate space? It is mesial to maxillary canine, distal to mandibular canine. See, in this picture you can see central incisor, lateral incisor, canine. So mesial side of the maxillary canine to distal side of the mandibular canine. So this space is called primate space.
Okay.
Then you have something called as flush terminal plane.
Flush terminal plane. Yeah.
So in that you have something called as mesial step, distal step, and deep bite. So mesial step is the upper first molar is more mesial to the lower. Distal step is the first molar in the upper is more distal to the lower. Okay. And deep bite is due to proclination of the anteriors, upper anteriors, the lowers go and hit the, what do you call it, rugi, palatal rugi of the upper. So that is the deep bite where the lower teeth are not at all visible, or like 50% of the lower teeth is visible. In that case, you call it deep bite. Okay. So in mixed dentition begins approximately at 6 years of age with the eruption of the first permanent molars. Okay. The mixed dentition period can be classified into first transitional period, intertransitional period, and second transitional period. So in first transitional period, emergence of first permanent molars, early mesial shift, that is force of first permanent molar, push the deciduous molars forward in the arch to close primate space and establish class 1 molar relation. So what is class 1 molar relation is the mesobuccal cusp of the maxillary first molar sits in the buccal groove of the mandibular first molar. So that is class 1. Class ideal occlusion is supposed to be class 1 canine relation, class 1 molar relation. Okay. So the primate space which we spoke earlier is used for this purpose. So that the first molar in the upper comes correctly in the position where it can sit in the buccal groove in the lower molar. Okay. So then you have exchange of milk deciduous incisors with permanent incisors, and there's something called as incisor liability. So what is this incisor liability is, see, the deciduous teeth are straight, correct? The permanent teeth are little bit, uppers a little bit proclined and the lowers a little bit retroclined, so that there's proper occlusions coming. So that spacing between the upper and the lower in the incisor region is called incisor liability. So that is 7 mm in maxilla and 5 mm in mandible. Okay. So leeway space of Nance. What is this leeway space of Nance? I'll show you a picture. Okay. See, leeway space of Nance, that is characterized by replacement. Okay. So mesodistal width of the permanent canine and premolars is usually less than that of the deciduous canine and molars. Okay. So coming, see, deciduous canines and deciduous molars are big tooth, right? Molars are usually big. So the deciduous canine and deciduous molar together, if you see the mesodistal width, it is usually more than that of the permanent canine and premolars, because premolars are smaller in size comparatively to molars. So you have excess of space left. So that excess space is called leeway space of Nance. So it is usually 0.9 in maxilla and 1.7 in mandible. So coming to counting it to both the sides, you have 1.8 in maxilla and 3.4 in mandible. So once more, I'll tell you what is leeway space of Nance. See, if suppose the deciduous canine and deciduous first molar, deciduous second molar, together the width is coming up to 12 mm. Okay. The permanent canine, permanent first premolar, permanent second premolar, it is coming up to 10 mm. So permanent teeth is 10 mm, deciduous teeth is 12 mm. So you have 2 mm extra space present. So that extra space is only called leeway space of Nance. Clear? Clear with this? So in first transitional period, you have first molars coming, you have a mesial shift, and you have class 1 molar relation, and you have exchange of incisors, and then you have leeway space of Nance. Okay, clear with this? So there's something called as flush terminal plane, which you spoke earlier, mesial step, distal step. See, if both upper and lower first permanent molars are in straight line, it's called flush terminal. It's just called terminal plane.
Okay.
Like they are in one plane, right?
Plane. Okay. Yeah.
Distal step is the first. The mandibular molar is more distal to the maxillary molar. Correct?
Yeah.
See, this is more back when compared to upper tooth. So this is more distal.
Yeah. This. Yeah.
So here maxillary molar is considered standard.
Yeah.
Just a second.
Yeah.
So here the maxillary molar is standard. Only the mandibular molars is moving. So based on the movement of the mandibular molars, you decide this. Okay?
Okay.
If mandibular molar is in straight line, it's called terminal plane. If mandibular molar is more distal, it's called distal step. If it's more mesial, it's called mesial step. Clear?
Okay.
Clear with this flush terminal planes?
Yeah.
So coming to second transitional period, characterized by replacement of deciduous molars and canines by premolars and permanent cuspids.
Yeah.
Combined mesodistal width, that is what I explained you earlier, leeway space of nines. 0.9 in maxilla, 1.7 in mandible. Okay?
Yeah. Yeah.
So there's something called as ugly duckling stage.
Yeah.
So it is seen in 8 to 9 years of age. Yes. So it is when the permanent canines are erupting.
Okay.
So what? See, initially when the centrals and laterals come, you have a big space in between. Correct?
Okay. Yeah.
And the teeth are usually bigger in size. Huge they look.
Okay.
They look very ugly.
Okay.
So that is why it's called ugly duckling stage.
Okay. Yeah.
So here centrals come, laterals come, but you have this midline gapping, midline space.
Yeah.
So it is a natural phenomenon. When the permanent canines come, it usually happens. Okay.
Okay.
So when the permanent canines are coming, displaces the roots of laterals mesially. Force is transmitted to displace roots of centrals mesially. Distal divergence of crowns and centrals causing midline spacing. This is carried by complete eruption of the canine. Okay. So what happens is, so when the canines are coming, they put pressure on the root of lateral incisors. So because they put pressure, they start coming mesially towards the midline. See, like this.
Yeah.
Because of the pressure. So because they put pressure, even this laterals put pressure on the central incisors. Correct?
Yeah.
So because the central incisors roots are going mesially, the crowns will start going distally.
Distally. Yeah.
Yeah. So once the canines start erupting, now they stop putting force on the root and start putting force on the crown.
Yeah.
So now the crown, which is distal, starts coming closer. Correct? Due to force.
Yeah. Yeah.
So once when the canines are completely in the arch, the tooth comes in correct position.
Okay.
Understood? See, when the root canine is coming here, the tooth is going away.
No, I know. I know. Yeah.
Okay. Okay.
Yeah.
So this is about ugly duckling. Then there's something called as permanent dentition period, where first permanent molar 6 years, second permanent molar 12 years, third permanent molar 17 to 22. Eruption pattern is 6, 1, 2, 4, 3, 5, 7 or 6, 1, 2, 4, 3, 5, 7.
Yeah. Okay.
In mandible, it is 6, 1, 2, 3, 4, 5, 7, 6, 1, 2, 4, 3, 5, 7. Either canine can come before the first premolar or canine come after the first premolar. Okay.
Okay.